Awesome. So, welcome everyone. Happy May. We are super excited to be back. We have Dr. Alexis Bender here today with us to talk about some program evaluation. Next slide. You're also on mute, Alexis. Okay. So, our next session is going to be on June 13th from 11 to 12. We are not changing that one. Thank you all for your flexibility in getting the updated link today. At the end of the session, I'll drop the PDF sign up for the next session in the chat. Next slide. So we will follow our usual agenda. We'll have our presentation. We'll have any room for Q&A, and then we'll go over any next steps that we have. And that's all that I have. Take it away, Alexis.
All right. So hi, everyone. My name is Alexis Bender. I'm the evaluation lead for the Georgia GEAR here. So I'm just going to talk a little bit about kind of program evaluation, what it is, why we do it, and give some examples from our project here. Just kind of some background for me by way of training. I'm a sociologist and gerontologist. I'm an associate professor here at Emory in the School of Medicine, in the Department of Medicine, in the Division of Geriatrics and Gerontology. I, as many of us, took a nonlinear career path, and following my graduate studies, I took a postdoc with the U.S. Army Public Health. And half of my position there involved evaluation of behavioral health systems broadly in Department of Army, as well as some kind of research and response efforts. And so that's really where I kind of got my teeth or thrown in the deep end of program evaluation. I guess I didn't really have any training in evaluation in graduate school. As a sociologist, it's not something that we often did. So kind of by the end of our little chat today, and definitely it's very hard for me to monitor the chat while we're talking, but you could raise your hand. I think I'll be able to see faces, but if you have any questions along the way, we can make this more discussion rather than lecture. But the goal for today is to kind of hopefully at the end of my little chat here, we'll understand the importance of evaluation, some evaluation terminology and types that are commonly used, and then I'll share an example logic model from the Georgia GEAR that we use to kind of guide our evaluation efforts. So what is a program evaluation? So these are some great definitions that you could find really online, but it's the systematic application of scientific methods to assess the design, implementation, improvement, or outcomes of a program. And the program, when we say program, it can really include anything. So organized action such as a media campaign. So you can get as granular as like, we're going to do this one effort. Is this thing working? Service provision, educational services, policies, or research projects. So we can think as narrowly as necessary or as broadly as necessary. And why should we evaluate things? Well, one, HRSA says we have to. So I think for those of us here on the call, like we have to, it's a requirement, right? It's part of all of our applications. It's what makes us competitive. But also we really want to know, like, how can my program or process be improved? We want to improve our processes and outcomes. We want to hear from our shareholders, our stakeholders, what's important to them. Are we meeting their goals as well as our own goals as a program? We want to find best practices and replicate those when we can. We want to measure our program impact and our accomplishments. I mean, that's a really big thing with GWEPs. We want to know, like, are we reaching the people that we need to be reaching? And is it making a meaningful impact in their work and their education? We need to manage our limited resources. If we have a program that's just not succeeding or not meeting our goals, then we need to make decisions. Should we remove that program and move forward? Because it's, with limited resources, we can only do so many things. And then obviously to improve our performance. And it's also important when thinking about evaluation to think about the good and the bad. Sometimes you need to hear hard things, and it's important to hear those hard things so that you're not continuing to go down a road that isn't beneficial to the program. Now, there's lots of different kinds of program evaluation. So there's formative evaluation, and these you might hear terms like a needs assessment or a process evaluation. And then there's summative evaluations, which are things like outcomes and impacts. But we can also do feasibility assessments, and we can do economic evaluations of cost and benefits. So some examples of a formative evaluation. So here we're wanting to look at the effort and the direct outputs of the program. And some of the key questions we might be asking during a formative evaluation are like, is the program operating as we intended it? Are we being efficient with our procedures and practices? Are there things that we need to modify with our scope of work or modify with our implementation plans so that we don't get too far into full implementation and realize like we've missed the mark very early on? So here, some of the things might be like the number and types of conference attendees, the number of patients that are being served, summary of application of successful funding rates, analysis of performance metrics. So, we might want to look at employee turnover, response times, customer satisfaction surveys, and customers could be anyone. For us in the Georgia GEAR, many of our customers are our partners. But sometimes those are the end users of our education as well. And then a portfolio analysis is another example. So moving from more formative is a more summative evaluation. Here we're looking at outcomes as opposed to just, are people attending workshops? Are we, getting some basic information from our stakeholders? Here we're saying like, are we actually meeting those goals? We have objectives. Are we meeting them? Are they measurable? And to what extent has the program met its short, medium, and long-term objectives? So some examples here might be surveys measuring change in awareness or behavior. So not so much like, did you enjoy the training, but like, do you intend to do anything with this training? Reviewing changes in policies that you can attribute to the program are things, ways that you can assess those. Measuring improvement in client outcomes. So in a different project that both Miranda and I work on, we're at the point where we're really doing some outcome evaluations where it's not so much, so this is one looking at diagnoses and visits related to memory assessment in the state of Georgia. So now we're at the point we're not necessarily looking like, are people coming in for assessments? Like that's our formative piece, but it's like, are those assessments clear and specific as opposed to just like people are getting an assessment? Now we're looking at the data. Okay, people are coming in for an assessment. Are they getting the right diagnosis? Are people able to access services because of a diagnosis that they wouldn't have without this program? Also, in a summative evaluation, we can look at the impact. So here we're looking at the extent the program has had on larger scale impacts. So looking beyond the short and medium term impacts to those longer term impacts, like those 5-year, 8, 10-year down the road impacts. And it's sometimes hard in the environment that we're in where we work on 5-year funding cycles. Well, I mean, with our GWEPs, it's 1-year funding cycles, hopefully for 5 years at a time. But, it's hard to sometimes get all the way to that, those much longer impacts that just take a long time to come. So with these, we want to look at, does the program have a longer term impact? What community or societal level changes have occurred as a result of the program? And these are often hard to tabulate because you have a lot of different factors that come into this along the way. But we can look at surveillance measuring. We can look at uptake. For example, in that other project that I was mentioning, we're looking at the uptake of annual wellness visits. A goal of that project is to encourage providers and along with GEAR to take on more annual wellness visits. So now we've been doing that program for what, 7 years, Miranda? Now we can see like, all right, we started this training 7 years ago. Are we seeing that needle move now? Because we know it's not going to happen a year, 2 year, maybe not even 3 years. Are people connecting to services or supports? Again, these are things that just take a much longer time to happen. So oftentimes we're asked, like, when should I evaluate, right? Just depending on what you need, what your program needs. But early on, really before a program starts, people should be doing program evaluation. And this is always difficult, especially when we're thinking about funded programs, because you don't have any money to do an evaluation before you have your right. So it's kind of the chicken and the egg, but in like gold standard, you want to do some evaluation before you have a program to evaluate. So you know your baseline and where you really stand before moving forward. So maybe you start with a needs assessment. What are the unmet needs and how can the program address them? And I think we do this. I know we do this kind of informally. We might not put this in a logic model, but as you're writing your proposals or as you're working on your programs, you know where your gaps are. And we know where our gaps are. And that's where we're starting to think like, this is what my program can do. And that's kind of a needs assessment, right? But documenting that could be helpful for seeing where that's going, for building the rest of your evaluation program. Then as the kind of the program starts to become established, you want to do a process evaluation. So you have this idea of implementing this program, checking in regularly with multiple stakeholders. Is the program operating as planned? What changes do we need to make along the way to make sure that we're in that direction that we planned for it to go? Or like we said in the beginning, like the good and the bad, like what are the things that we want to keep? What are the things that we need to assess, adjust, remove along the way? As programs become established, we start moving into the outcome evaluation. Oftentimes what happens is people jump straight to the outcome evaluation and missing that formative piece, mainly because funders or other people, they want to see your outcomes. Right? We want something measurable, but it's, so these things kind of happen simultaneously. We want to see, like, is the program achieving its objectives? And then, like I mentioned, the impact evaluation, which is once a program is mature, not necessarily in the first 6 months, but in the first year, unless you're talking about a very small, like this is a one-off media campaign. Again, the timeline for these might be different. But what impact has the program had on our shareholders, on funding, on economics, things along those lines? The key with evaluation really is to outline the scope of the evaluation. So keeping the purpose in mind, and Miranda and I sit on a couple of evaluation cores. And oftentimes people come and they say like, well, we want to do this, we want to do this. And we're often saying like, let's go back to the purpose of our program and the purpose of our evaluation and figure out how that fits in here. If it doesn't fit, maybe that's not the project we want to take on. So always keeping the purpose of your program in mind is key. Data collection should be focused on the purpose of the project and the goals in mind. So oftentimes we see like, just let's add more surveys, let's add more questions, let's add more satisfaction. It's like, what is this measuring? Where does this line up with our logic model? And I'll go through our logic model in a second. As I mentioned, trying to find that direct correlation between the program goals and the outcomes once we get past that formative stage and we're like more into that summative, it's hard to find that direct correlation because there's so many complicated processes, right? We only can control so many things in our programs, but we can try. we can try our best to at least draw a thick dotted line. You cannot control for all possible variables. I think that goes without saying for any kind of implementation. And so it's also important to have realistic expectations of, the goals of the program, knowing what metrics can be gathered and evaluated to tie to those program goals. And also just keeping in mind, like, what are the most important things that you need to know about your program? And I say this knowing that with HRSA and GWEP funding, there are certain things that we have to report. And so, yes, those are important, but then also to keep your program moving in the direction that you want ultimately it to go in, it's also important to track some other things beyond those metrics, because there's important things that you might want to know about your program that maybe are not in those HRSA metrics. And so trying to balance that. Again, we all have limited resources as well. So this is our logic model. It's a little busy. There's a lot of things on here. This is in our first application. So it's a little old, but I looked through it. It's pretty up to date, and we're still following most of these. So a logic model, anybody on the call used a logic model, familiar with logic models? Just like raise hands. I can't see the chat easily. Got a thumbs up at least. All right. So a couple. Great. And then for others, this might be completely new. Kind of like, what is a logic model? I like logic games, but it's not necessarily the same. So in a logic model, we have our inputs. What is coming into the program that we can use and capitalize on to get to our outputs? So here we have resources that we put in, not necessarily from external, but what can we do? So here we outline our administrative and program governance infrastructure. We have educational and clinical expertise on our team. We have evidence-based models that we use and we rely on. We're not reinventing the wheel, right? Our programs and partners, we have advisory boards, we have our ITs, and then we have our HRSA funding, right? But then we also leverage internal funding to make our programs work. So with these resources, what can we do? These are the things that we try to make happen. These are our outputs. These are kind of our program objectives. So we want to develop and implement age-friendly curriculum and interprofessional development training. We want age-friendly care. We want to disseminate evidence, and we want to stand up regional trainings, right? So these are our activities and objectives. And so everything that we do after that should be following along with those activities and objectives. So who's receiving who are our stakeholders, shareholders for these activities and objectives? So we've kind of laid them out here. It's not a one-to-one. You don't have to like follow directly across. Sometimes it is nice and neat like that. But these are all the people that we're trying to train, right? And then I need to move my little controls out of the way. We have our outcomes, our short-term outcomes. What are the things that we can measure within 6 months, within a year of program implementation? What are things that are kind of more on the medium side of things that are going to take a little bit longer? And then these long-term outcomes. And the long-term outcomes are always hard to measure. They're just hard. There's no two ways around that. But we try, right? Like we try to measure them and we try to be realistic in what we're trying to do. We're not trying to say like all of Georgia is going to be age-friendly and amazing and dementia-friendly, and we're going to reduce the cost of healthcare and everyone gets a trophy. Like we can't do that. But we can do some, we can look at costs of care. Right. It's a long-term outcome. It's something that Miranda and her team with CMS data can look at and compare. But it takes a long time to get to this point. So really we focus on these short and medium term outcomes with these long-term goals in mind. And then with our logic model, we think, okay, what are the assumptions? So for all of this to work, we have some assumptions. Number one, that targeted training will change primary care settings, right? That resources are available for outreach. So if these things change, then we have to refocus our goals. And similarly, we have external factors that influence kind of our evaluation and what might happen with this implementation. So one is that, the funding continues, right? That is an external factor. And if that changes, then we're probably not going to meet long-term objectives. That there's coordination of care across our settings. If something happens along those, then kind of this is going to fall apart a little bit and we're going to have to assess and adjust. So this is kind of our roadmap that we use, and we touch back with it pretty regularly to make sure, like, are we still heading in the direction that we want to be heading in? So it's kind of just broken down a little bit, more narrow focus is kind of taking those pieces. Some of them I've talked about already, but these are the things that we invest, our resources, our activities, our outputs, and then just easier to absorb. It's the same thing that's on the previous slide, just easier to digest. So our short-term, implementations of trainings, like those are the things that we can checkbox. So did we do the training that we said we were going to do? Did people come to the training? Yes. How many of people came, and who are those people? Very short-term objective, very achievable, right? And then, all right, we're on the right path. These next ones are more kind of in this medium term, like, are we actually improving linkages? It's not as easy to measure, and it's not as quick either. Things like increased knowledge of clinicians, those we can gather with knowledge surveys before and after trainings. So how do we gather all this information? So we use a lot of different sources. We can use program data, so things like our policies, our SOPs, our scope of work plans that we put together. Those all align nicely with our evaluation efforts. So as a partner is implementing their program, it aligns with our goals as well. And we can check those things. System databases, we can use, when available, complementary administrative data sets. So we can tie to things from like the American Community Survey, Miranda, you're probably better on the data sources, but there's data sources that are available that you can get. There's also data sources that you can pay for, which they get pretty expensive. So unless you have a lot of money for that. But there's publicly available documents in media. And then a lot of what we do is primary data collection. So these include surveys, focus groups, and interviews, attendance sheets, things along those lines that are our primary data collection. I would say 90 to 95% of our data that we use for this program is primary data collection. So these are some of our evaluation activities. These are primary data collection sources. So on the quantitative end, we do partner surveys of resource utilization. We do this annually, send it out, like, of the things that we provide to you, what do you use? What would you like to see changed about these? We also have the training metrics that we put into the electronic handbook. We do this pretty regularly. Really, we ask our partners, like, anytime you have a training, please send us this information so that we can track it and put it in. And then we take on a lot of qualitative efforts too. These are not necessarily things that HRSA asks us to do. We just decided they're important to us. So we do annual interviews and focus groups with all of our partners where we ask them, how are we doing as a program to meet your needs? Because each of our, partners have their own individual program needs that they need to meet. So how are we doing to meet those needs? What are things that we could do better or differently? And especially as we take on new partners every year and some fall off. And so it's not something that we ever see ending. We do quarterly town halls that are really informal, where partners can come talk about the things that they're doing. We take that in as information and we can use that for our reporting metrics and to write up our reports. And then early on in our program, because of the way we're structured, we have a lot of partners that know of each other, but don't work together necessarily. And so they were asking, like, I don't really know what this other group does. And so we implemented a Georgia Gear partner share where it's just an informal Zoom call because, of course, we all got started during COVID, right? So an informal call where people could just join as they wanted and share resources with one another, ask me questions about other programs. We could get their input on things. So it's kind of like that constant formative evaluation, but without it being like a formal, I'm going to sit down and interview you. And a product and wanted others in the group to test it out for them before they sent it out for prime time. So they could do like peer evaluation as well. So those are some of the evaluation activities that we do and a little brief introduction to program evaluation. And I will, if anybody has questions, thoughts, I'd love to hear what you all do. And if you have questions about evaluation. All right, you're all experts. I know you are, actually. I'm not saying that sarcastically. Like, you don't need me.
It's our 7-second rule of silence for 7 seconds means you move on. Thank you, Dr. Bender. I think it's always a good to also take a step back. Like, we know what we're doing in the day-to-day grind, but like bring it back into context of a framework around what is the evaluation framework. I agree with Dr. Bender, with Alexis, that sometimes you have to remember that you put that logic model together back when you put the application together, and go back to that, especially when you're struggling to decide. Sometimes our programs take meandering paths that don't look like what we originally anticipated or planned, and so it's good sometimes to pull that back out and see. If their path led them off the way, is there somewhere that it lands in this logic model, or can we just not? It's no longer within any scope of the logic model. So maybe we reevaluate, how that program is being funded and what it looks like. Maybe we steer that piece of the program back onto the correct path.
Yeah.
So.
And I think having a logic model, they can take some work to put together, but it's an important roadmap for your program. And when you do have that partner or, that one investigator that's part of your group or that one educator who's just like, has this wild hair all of a sudden, and it is a great wild hair, it just does not fit with your program. And sometimes it's hard to have those hard conversations of like, we're not going to support that. But if you have the logic model, you can say like, show me, like, let's talk about where this fits in the larger scheme of the program. And if we can make it fit to that, then that's great. And if we can't, like, maybe like you're saying, Miranda, like either let's find a way to make it work, or we have a discussion of like, I don't think this is a good fit for that part of your project anymore. Like, let's keep funding the work that is relevant to this program.
Yeah. And I know sometimes we have some of our partners come up with really great new ideas that weren't in the original scope of work that we at this stage wrote 2 years ago, but by the time you get to the fifth year, you wrote them like 6 years ago. And evaluating whether or not we would like to support that and potentially rearrange some budgets to make it happen. We use the logic model. And so this has happened a couple of times with we're gonna, do this other plenary session, or we want to do a special interest group, and can we fit in some funding for that? Being able to take it back and really squarely place it on the logic model is gives us good rationale for supporting that program.
Mhm.
So thank you, Alexis.
Yeah, absolutely. Any other questions from the group about evaluation?
I see some appreciation comments in the chat. Alex, if you want to look at those.
Thanks.
Okay, Grayson, we can go to the next slide. So next steps, our next meeting is going to be on Friday, June 13th. I did want to let everybody know a heads up that we've gotten some reports out from our not West Coast, but farther afield individuals who say that this time slot actually works a lot better for their calendars. The 3 to 4 time slot, the 11 a.m. Eastern time slot is actually very middle of the night for our individuals who live in Alaska or in Hawaii. And so I'm gonna ask Grayson if she can update the calendar invitation. So this is your heads up. We're gonna move the time slot from the 11 to 12 o'clock hour to the 3 to 4 o'clock hour to accommodate requests for later. I will admit that I was thinking about California, and that 8 o'clock was early, but not unreasonable. But yes, middle of the night is a bit unreasonable. So just a heads up that will be coming down the pike. As always, we are recording, and we'll send out the recording and the slides for this one. And then
Just be sure to put your name in the chat if you have not.
yes, your name and your affiliated GWEP in the chat so we can report attendance for our HRSA individuals. Anyone who, if anyone wants, we have a little bit of time. If anyone wants to give a report out of a great presentation that they saw at AGS, or anything that they're planning, if anybody has any, I know sometimes we get called for proposals. The late breaking session, I think, for GSA is open. So if anybody has any,
July, it opens in July.
it opens in July. Yeah. So if anyone has any ideas and would like to solicit some co-presenters, this is a great group to do that. And a reminder, you can also do that through Grayson set up the listserv. So if you're looking for co-presenters or anything like that, then you can also use the listserv for those activities. Any word on the NOA for next fiscal year? So the latest that we heard was at AGS was that the funding memo had been submitted to the current HHS leadership, and that the expectation is that it will be funded. Reminder that the year 2 funding comes in the current federal government fiscal year, which will not end until September 30th of 2025. So the expectation is that we will be getting our notice of awards for year 2, and those usually come in either June 29th if we're lucky, but June 30th through July 2nd is usually when those come in. HRSA in the past has been very quick with those. With the current political environment, I wouldn't be surprised if they're a little later this year, but I expect we'll see them in early July. And I think that HHS is still under a communication freeze. So a reminder for those who are on the call and evaluation leads, but not the contact program director, to remind your program director that the emails that they're receiving from our program officers are coming only to the program directors. We actually asked our program director to just set up a Outlook rule so that any emails coming from Nina before before last month, but from Jen Solomon or any of the individuals from HRSA, if he could just automatically, those would automatically forward to us so that we made sure that we have the current communication. He was happy to do that. And so you might want to talk to your program director about that as well. It helps to make sure that none of those communications fall through the cracks. The electronic handbook typically opens on July 1, and you have until July 30 to put all the final metrics for the year. We do have a technical assistance call that is upcoming. I'm trying to remember the date. Grayson, do you remember the date for the technical assistance?
I am pulling it up right now.
Okay, so it's Wednesday, June 11th. So hopefully that will give us information. I know that in years past, they gave us specific explicit instructions on how to enter our patient-reported outcomes, but that was when they were explicitly given to us as MIPS options. So I don't know if we will get explicit instructions this time around on those patient-reported outcomes and how to enter them into the electronic handbook, because as we know, those are very much health reports. So as Alexa said, one of ours is annual wellness visits. And so, how do we enter this in the system as patients that got annual wellness visits? It's not really a training. It doesn't have a duration. And so they gave us explicit instructions in years past for those on the call. If we don't have explicit instructions this time, my intentions are to go back to last cohort and use those instructions to enter our measures, because we actually used a lot of the same MIPS measures, and so that's how I intend to address it. And then this says, do we know if the June national meeting is still happen? It's the same date as the APRTA meeting. I think
I think the APR technical assistance meeting will take place of the June meeting.
I think you're asking about the GWEP mandatory meeting. So they're at different times. I cannot say for certain yet if our program officers will decide to hold a separate meeting with us. So the monthly meeting is yes, okay. So the monthly meeting is usually at that 4 p.m. slot. And the June 11th APR meeting is actually scheduled from, it's actually 90 minutes, and it's scheduled from 1:30 to 3. So often they will count that as the monthly mandatory GWEP meeting, but I'm not sure. I think probably some of that will depend on whether or not there are other communications that they want to give us outside of the technical assistance call. For those who are new GWEPs, is run by HRSA. It's not run by the GWEP program officers. It's run by the GWEP technical assistant. Not even the GWEP technical assistants. It's run by the HRSA electronic handbook technical assistant individuals. So there will be nuances about the GWEPs, but it's really usually ran by the higher level. And then our program officers will be there, but the ones who run the meeting are the higher level HRSA technical staff. Any other questions? And then Grayson, you can do the next slide, please. So as always, if you can fill out any feedback, and then the last slide is just if you have topics you'd like us to look at. We would love to have any feedback. If anyone would like to do a presentation, please reach out and let us know. Okay. We're happy to give you guys back almost 15 minutes on this Friday in May. I hope everybody is having good graduation season, and that everyone had great presentations at the conference.